Hi, welcome to a new program of Healthy Life. Today we have a very special guest, a professor of urology, especially particularly specialized in uro-oncology. Welcome, Dr. Serkan Altınova.
Welcome.
Dr. Serkan is a very highly qualified surgeon, particularly in urologic cancers, especially in prostate and kidney cancers. He has performed lots of different kinds of operations using several highly modern equipments, sometimes robot or HOLEP, which we will discuss in detail in a few minutes. But because the topic is quite large, we will want to focus on especially prostate. Now, before that, we want to hear from you. Who are you? What are you doing? Of course, we know you very well, but our guests may want to know.
Okay, first of all, thank you very much for inviting me. I'm very happy to be with you here and wish to be again. I'm 48 years old and dealing with urology about more than 20 years. Mm-hmm. I finished my residency about 16 years ago, and for the last 14 years, I'm dealing especially with uro-oncology, endoscopic, laparoscopic, and robotic surgery. I'm still in urology practice. Once I was working for government hospital. Mm-hmm. Now I'm working for only myself in my private office and some private hospitals. As I said, dealing with uro-oncology first.
Very good, very good. We said we'll speak about prostate today. What is prostate? Is it a necessary organ? What does it do?
Prostate is an organ only found in men. It's an endocrine organ. With the help of some secretions, it prevents the urinary infections. And also, think about your ejaculate. About 90% of the ejaculate is coming from prostate and seminal vesicles. And the rest of 5 to 10% of the ejaculate, we call it sperm, is coming from the testes. So, prostate is an organ found in every man and getting enlarged by time with the increase of age.
With the increase of age. Okay. Does every man have a prostate problem during all his life?
No, not all the men, but the normal size of prostate is about 20 grams. By the age, especially, and by the help of the hormones, and sometimes for genetic reasons, the prostate will get larger. But in every man, even if it gets larger, every man will not have prostate problems.
Oh, very good.
If the enlargement is just outside of the prostate, it will not obstruct the urinary way, then the man will not have maybe any problems or urination. But if the enlargement of the prostate is just inside of the prostate or just the mouth of bladder, then every man can have problem.
I see. This depends on the extension of the prostate.
Enlargement of the prostate does not mean that every man will have a problem of urination.
I see. That's very good. Inshallah, no one has.
Inshallah.
Okay. Is there anything we have to take care of not to have a prostate problem? What must a man do for all his life not to have a prostate problem?
For all the man's life, every prostate, as I said before, will get larger.
Okay.
You cannot do anything to prevent the increase of the volume of the prostate. You cannot do anything. But you have to be careful for something. What are they? First, by age, the prostate will get increase by the volume. So every man after 50 must have a check for every year, even if they don't have any symptoms or any complaints. And with family history, especially with the first degree of relatives, if they have a prostate problem, everyone must again have a check for every year, even they don't have any problem. So you cannot do anything to prevent it, but if you have a check every year, every man must alert on it, they will get rid of the problems then.
Okay. Before it's getting a bigger problem, you may prevent whatever going on over there.
Yeah.
You said check. How will we check it? Just by some blood tests, or does every man need to have a prostate examination?
Of course, both of them. First, we have to check from the blood. We call it PSA, prostate specific antigen. We have to check the value of PSA. If it is in normal degrees, there is no problem. But the second one is physical examination. It is sometimes hard for men to have an examination because with our forefinger we are making the examination from anus. So sometimes some of the men have difficulty with the examination, so they don't want to come to the doctor or something else, but both PSA level and examination is important. Why? If there is nothing wrong with the examination or PSA, we do nothing.
Very good.
We only see if the patient have any complaint or not. If there is something wrong with PSA or with physical examination, then we can make a biopsy. If it is a benign or good or bad disease. If both PSA and rectal examination has abnormality, the prostate cancer level is up to 45 to 50%. That's why physical examination is important.
Is necessary. By saying this, I understand that a person may have a normal PSA level, but have a prostate problem.
Yeah.
And this will be diagnosed by physical examination.
Yeah.
Nothing is necessary. Otherwise, prostate examination may be normal, but PSA level may be abnormal. Both have significant.
These are all different from each other.
Yeah.
PSA, physical examination is different.
Okay.
The problems of prostate, I mean the symptoms, I mean the complaints of prostate is different. The symptoms are because of the enlargement of the prostate. The prostate, if the prostate is not big, maybe someone will have a cancer, but no problem.
Yeah.
We don't know.
Yeah.
Because the symptoms are only related with the enlargement of the prostate.
Yeah.
This is different from PSA or examination. But all of them are important.
Yes. And you said at the beginning, the extension of prostate, the direction of extension is very important. If it goes inwards, it may have it may cause symptoms, but outwards, it will not cause any symptoms. Thus, should I understand that every man has to have a rectal examination for prostate?
Sure.
Of course.
Must. It's a must.
Okay. If someone from our audience cannot find a urologist around him, but if he has a radiologist, does a ultrasonographic examination reveal something about prostate?
Ultrasonographic examination can only say something about the volume of the prostate.
Yeah.
They will not even see prostate cancer or other bad diseases. PSA is important, but only if you want to do imaging technique, MR is important, MRI. But it's a spatial MRI called prostate MRI, so you cannot find prostate MRI everywhere.
Yeah.
Normal MRI machine has to have something extra to reveal a prostate cancer and to image prostate. But you cannot find in every hospital prostate MRI. But it's not a routine technique.
Yeah.
We want a prostate MRI when, if you want to take a biopsy with a fusion biopsy, or the PSA is high, we perform the already biopsy, but PSA level is going still high, then we can have an MRI. It's not a routine technique.
Not routine.
Yeah.
I think it's called multi-parametric.
Multi-parametric prostate
MRI.
MRI. Yeah.
Yeah, and it's not found in everywhere.
Mhm.
I think it's found in some specialized hospitals
Yeah.
where they are lucky and may add additional value to
Mhm.
whatever we find. I can understand that blood tests reveal something good,
Mhm.
but ultrasonography does not show us
Mhm.
too much. And examination by the finger, I think, gives you some idea about the
Mhm.
consistency, hardness, any fluctuation,
Yeah.
maybe an abscess condition over
Yeah.
there. Lots of knowledge.
Yeah.
Indeed, because of this,
It's
examination
just like this. The
very
consistency
important.
of prostate is important. Prostate is an elastic organ.
Yeah.
Feel here. Feel here. You will
This
just feel prostate like this if
Ah.
it's normal.
way. Normal.
If it's a smooth one, like this, smooth, then you can think that there may be a prostatic inflammation, especially in young men.
Oh,
Young men. But if it's a rough or hard or nodular prostate, then you can think that this is the most important thing. This may be a cancer.
okay.
So if the PSA level is normal, but you have a hard or rough prostate, it doesn't important. You have to take a biopsy,
I see.
even if PSA is normal.
Even if you say
So
it's normal.
what does this mean? Only itself PSA is not important. They are both important
Yes.
together.
Both must be done
Yeah.
in men over 50 years of age.
Yes,
Or
in every
45.
man with after 50 years, but if there is a history of prostate cancer with their relatives, then after 40 years.
After 40 years. If there's a risk, after 40 years. If there is no risk, after,
After
50,
50
years. Do not wait to have some symptoms and visit your urologist for some blood tests and physical examination. Indeed, the physical examination is not so hard, as I think, but some people also do not.
They are getting afraid.
Yeah, they are
They
getting afraid. But it's not so hard. And you feel lots of different conditions, and you may even diagnose something with that physical examination too. How do you diagnose benign or malignant conditions of prostate?
With the physical examination, if there is an elastic prostate like this,
Yeah.
and if PSA is normal, then you can say it's a benign disease,
Oh, I
only
see.
prostatic enlargement. But if there is something wrong with the physical examination or PSA, then we can perform a biopsy. But biopsy does not mean that it's a bad disease. So about 70% of the biopsies are benign disease.
Very good.
About 25 to 30% is malign disease,
Malign
prostate
disease,
cancer.
yeah.
But this is related with only PSA. If there is something wrong with physical examination and also with PSA level, then it increases up to 50%. But biopsy does not mean that it's a prostate cancer.
I see. I see. Is it easy to perform a biopsy? For you, of course.
Generally easy.
Generally
Generally, we perform it with local anesthesia.
Very good.
But sometimes some men gets afraid of biopsy. Then we can have a general anesthesia. But
Oh,
about
very good.
95% of the biopsies we are performing with local anesthesia.
And the patient
It's
is
about-
comfortable for that.
It takes about 15 minutes.
Oh, very good. The patient is comfortable. Does not have any
Comfortable,
problem. Very
yeah.
good. Very good. And you said every man must have a physical examination after 50. But if the relatives do have some prostate disease, then the age will drop to 40. Must I understand, is there a genetic linkage?
About 9% of the cancers are genetic, getting with genetic transmission. So if there is 1, 2, 3, or 4 relatives, the risk increases up to 11 times with 4 relatives. So that's why we check them before 50.
I see.
Also, the man before 50, but with no genetic prostate cancer or no cancer with relatives, if there is a symptom, then also we can check them. But if there is no symptom, no problem, no other thing, the optimal age is 50. Now, in some places, in some centers, it's 45. But with family history, it's sure 40.
40.
Even if there is no problem,
Even if
40.
there is no problem.
Yeah.
I see. Yes, this is the major problem. How do you make a prostate examination? How do you perform it?
Yeah, with our finger, of course, with our finger. We are doing it from anus, rectum. With our forefinger, we are going from the anus. We are feeling the prostate,
Okay.
consistency of the prostate. It takes about 10 seconds. Most of men get afraid of but we cannot do anything.
Yeah.
There is nothing else to do this. Only ultrasound from rectum, but it does not give the sense of our forefinger.
Yeah.
So examination with our finger is the most important thing.
And it lasts about 10 seconds.
Yeah.
And 10 seconds is a very, very short time.
Yeah.
Every man must have this prostate examination for 10 seconds if you want to be healthy. I think we will discuss it in the second section of our speech, but I think it will be very effective for them if the cancer is found early and managed earlier, and they will have a much better prognosis. And do we need surgery in benign prostate conditions?
Of course, in some conditions, but first of all, we have to evaluate all the persons, all the men. All the men will not have or need prostatic surgery. First of all, the symptoms are important. What are they? They are usually about urination. The most important thing is waking up at nights, especially more than one. Going to the toilet, I mean the frequency of the urination is important. If it is less than 2 hours, it's important. The urine flow rate is important. If the urine flow rate is getting decreased time by time, it's normal by age, but if it gets decreased, it's important. Sometimes pain with urination and sometimes blood with urination is important. So, also, we can have some tests. Blood tests, I told, physical examination, and we have a special machine that is counting the flow rate of the urination. It's important. We evaluate the degrees of the urination. According to it, we have also some scalas. According to it, we can only watch. Go, if the symptoms are higher than we expect, then we can have a medical treatment. And if the medical treatment
to increase the flow rate?
Medical treatment, if it's all right, yes, they will go on with medical treatment for all their lives, like an hypertension. They will not give up the medication. But if the medication is not enough, then we may think about surgery.
The medication is to increase the urine flow throughout the prostate. Thus, the patient can avoid.
What does it do? The relaxation of bladder, neck, and prostate. It only decreases the urine flow rate. Only decreases the urine flow rate. Does not affect prostate volume. Does not affect PSA. Also, we have some medication that can decrease the volume of the prostate. We sometimes give them. We sometimes give extra treatment with the other medication if the prostate is large. If the prostate is not too large, they will not have any effect. So we sometimes give additional medical treatment. One is the relaxation of prostate and bladder neck, the first step. And the second step, sometimes we give both of them. It decreases the volume of the prostate.
The volume of
but
prostate.
it can have some side effects.
Like what? Because you said there is a medicine that decreases the volume. Thus, why do we need surgery? Give us
in
all the
10% of
medicine.
the patient may have libido problems and erection problems.
These are very important.
Only in 10%.
In 10%, patient may have
So we
erectile
especially
dysfunction.
give this medication with higher age and higher volume prostate.
I see. And they may no longer need increased libidos or erectile functions. Thus, at that time, we may provide them to the patients to get rid of the risks of anesthesia or surgery. Are there any alternatives in benign enlargements of the prostate glands other than those? I think those are the ones we can...
There are also some other medications, but they are not as effective as these medications. But sometimes we give them. These medications, I told, are the first step, and the others are the second step. So we sometimes use them, but in every man, instead of having an increase in the urine flow, these medications only give them some symptomatic relaxation. So it does not increase the volume, flow rate of the urination, but gives comfort only.
I see. Then we have lots of medications. But you have said that sometimes we also perform surgery. I think these are the patients. You have tried all the medications and did not...
Surgery is the last step, of course. Last step. We have many kinds of surgery. First, open surgery. Nowadays, we are only having open surgery maybe less than 5% of the patient. Because when we need open surgery, the prostate must be very large. But if there is an experienced urologist, even with a large prostate, they can perform endoscopic surgery. So open surgery, what's open surgery? You have an incision like this, about 10 centimeters.
From the bottom of the abdomen.
But in endoscopic surgery, no incision. We are using the natural ways of the urination and doing it endoscopic surgery. What are the advantages? Less blood loss and less hospitalization time and less catheterization time.
Yes.
But endoscopic surgery differs from others. There are many types of endoscopic surgery, like TUR, we say TUR, the gold standard now, but also the HOLEP is gold standard now. What is the difference of the HOLEP? It's a laser treatment. With the laser treatment, the side effects are lower. What are the side effects? The main side effects important for men, is urinary leakage and erection problems. They are lower with HOLEP surgery. And also, blood loss is lower with HOLEP surgery. The catheterization time is lower. When you perform a HOLEP laser surgery, the catheterization time is 1 to 2 days. With TUR, endoscopic surgery, 3 to 4 days. With open surgery, about 7 days for catheterization time.
Dr. Serkan, this is very, very important. This is an important step. And I think we will speak about more about this. I think it will be better for all of us to have a small break, then continue our conversation, because this is, I think, very important subject. And it has several advantages or older techniques. And let's meet about 5 minutes later. Welcome again. We are here after a short break with Dr. Serkan Altınova, who is a professor of urology, especially uro-oncology, cancer of the urologic system. But we are talking about benign diseases. After a few minutes, we will talk about malignant diseases too. And we were talking about a very important subject. You have called a very special technique, a new technique, called HOLEP in the management of benign prostate disorders. Can you describe this as more? What is it? What is it used for? Is there any alternative? And what advantages does it offer to us?
HOLEP gives us a holmium laser energy.
A laser.
We use it, laser energy, holmium laser, in stone disease operation and prosthetic operation. But prosthetic operation, HOLEP machine is different from the others because the machine must have a high energy. But with a low energy, you can only do stone disease, fragmentation. But if the machine has a high energy, some machines have both, then you can do also prosthetic operations.
Oh.
So with a high energy HOLEP machine, we are doing a prosthetic operation endoscopically, no incision. We are excising the prostate with the help of the energy of the laser. So what does this give us? First of all, side effects. The main side effects, the important side effects for man are, first of all, urinary leakage. The urinary leakage is less with HOLEP. And also erection problems. The deep energy is important. With a quaternary energy, the energy goes deeply to the tissues. So it affects the neurologic system of the prostate and the penis. So erection disorders are higher. But with the laser, the erection problems are less.
I see.
Also, the catheterization time is important. We are putting the catheter in and remove it after 24 to 48 hours, 1 to 2 days. So why is this important? The infections, the urinary infections related with the operations are generally related with the catheterization time. If the time is less, the risk of infections is less. If the time is long, especially with open surgery, then the infection risk is higher. Also, bleeding is less with HOLEP. We generally don't need any blood transfusion after HOLEP.
It's excellent.
Yeah, but one thing is important. The only disadvantage is the cost. The HOLEP machine is more expensive than the others. So it's not found everywhere. And also the adding of the machines are also expensive. The probe or the morcellator. So it's more expensive than the other treatments. But it's more comfortable.
It's more comfortable. People has less pain, less bleeding, less urinary leakage. That's incontinence. This is very, very important.
The hospitalization time is lower, and this means that you can go into social activities quicker. Yeah.
You can gain your life very easily. And these are indeed important things. Maybe you do not need to give extra hospital money, but you may give some more for HOLEP to be more comfortable.
Also, there is one more advantage of the HOLEP. With the big prostates, when you are making TUR, we have a limited time because of the liquid we are using. They have some side effects. So our aim is to finish the operation, especially after 1 hour. But with the HOLEP, we are using only serum, not spatial liquid. So with larger prostates, you don't need to have open operation. Then you can make it the operation with HOLEP endoscopically, even with a large prostate.
Even with a large prostate. That's very good. That's very good. Do you have anything to say about HOLEP? If not, I will go on with malignant diseases, especially.
Now HOLEP is getting more popular, and maybe now it's the gold standard. But we have to say that it's more expensive, and it cannot be found in every hospital.
I want to ask another thing. If everyone has HOLEP, can everyone use it, or does it need a more qualified?
Of course. For every operation, qualified people is very important. Qualified doctor is very important. The number of the operations you do is very important. But it changes according to the operations. Some operations may need 20, some need 100. So HOLEP is not a very easy surgery, I have to say. So only qualified doctors must do HOLEP, must perform HOLEP.
This is extremely important knowledge.
So if the doctor is not very qualified, sometimes they cannot finish the operation with HOLEP. Sometimes they can convert to open operation or
Really?
convert to TUR operation. Yeah.
Oh,
Yeah.
this is very bad.
But generally, this is at the beginning of the operation. After 20 to 30 operation, the doctors get really qualified.
Very good, very good. We hope the number of qualified doctors increase and number of HOLEP or other new technologies we don't know yet increase and give us more comfort about the examination of and examination and treatment of prostate and other diseases too. And I think this is good for benign diseases. Can we also speak somewhat about your main subject, indeed, urologic cancers? I think we are lucky that they're not seen so frequently, but not so low in low numbers too. Prostate cancer and other cancers of urologic systems are not so frequent, but not so low either. Can you give us some numbers about them?
Yes, prostate cancer is generally seen after 60, and it's the most seen cancer in men, and in all over the world, second cancer after lung cancer. So it's important.
Right.
If we live up to 100 for every man will have a cancer. Every man. If we live up to 100 age, every man will have
Any
a cancer.
cancer or prostate cancer?
Prostate cancer.
Prostate cancer.
Every man.
Every man.
So it's important. But every cancer is not important.
Should we say that don't live up to 100?
Yeah. If you live up to 100, you are 100% prostate cancer.
Prostate cancer.
100%. But the prostate cancer is different from the others because it's growing very slowly. Most of the prostate cancers are growing very slowly.
Very good.
And one thing is important. Every man say that I have no problem. We don't need to have any problem.
Yeah.
The only problem is age. It increases by age. So, as I told before, every man must have a check after 50,
After 50.
even if they don't have any complaint.
Any complaint? I understand because prostate cancers grow very slowly. Determining a prostate cancer at the very early stage, at the very small size, is very important to have a successful cure without having significant side effects of the procedures, surgeries, etc., etc. I think this is why you recommend everyone to have check after 50 years of age.
Of course, for every cancer, early diagnosis is important. Also, for prostate cancer, early diagnosis is important. But something differs prostate cancer from the others. When you say a cancer, you have a cancer, every man gets afraid.
Yeah.
But sometimes, with very small cancers, we don't do any treatment.
Really?
Yeah, we only get them for active surveillance. What we do, check PSA level, physical examination, and some repeated biopsies.
Why do you do that? Is it so benign?
Yeah, some prostate cancers are not important, are not clinically important. So you don't need to treat them. If you treat them, you will have some extra side effects, you know. Prostate cancer surgery and other treatment options of prostate cancer, you know, may have very important side effects.
I see.
So
Treatment
to
may
prevent
cause
them from
more
the side
problems.
effects, we are only watching them.
Watching them.
Yeah.
Just following up.
If there is a small amount of disease, sometimes for a very small amount of the prostate cancer patients, sometimes we only watch them, we check for PSA, physical examination, sometimes biopsies, and if they don't have any progression, we still go on watching them.
Go on, just follow up.
Just follow up.
Active follow up.
Yeah.
Check regularly.
Yeah.
If he has any symptoms try to resolve them,
Yeah.
and watch the size of the cancer. That's good. Yeah, are all prostate cancers behave like this, or is
No,
there a
only small amount of the prostate cancers.
Is there a name for that?
No, it's prostate cancer, but
Uh-huh.
you can say that clinically unimportant
Clinical
prostate cancer.
unimportant. Some of them may be
Uh-huh.
this. Of course, you are the person to say that
So-
this is important or not important.
What I want to say is, prostate cancer is a cancer, but you don't need to have to be afraid as the others. Every cancer is different from the other, I want to say. So prostate cancer is different from the others, growing very slowly, but if every man can have a check at the accurate time, we can see it and treat it properly.
Also, these different types of prostate cancer do also need different types of approaches. Like when you said, just follow up
Yeah.
or significant surgeries and lots of other treatment options in between them.
So, not only the amount, the PSA level, the degree of the cancer is important. Also, we can sometimes have imaging techniques if the cancer have a metastasis or not. So, if the cancer doesn't have any metastasis, if it is just into the prostate, if PSA levels is lower,
Very good.
lower, and only a small amount of cancer, then we can follow it up.
Just follow it up. Otherwise, may have
Otherwise, we
significant
have to
surgeries.
make another definitive treatment.
Very good. You have so talked about HOLEP in prostate surgery, especially in benign conditions, and sometimes in stone diseases. We also hear robotic surgeries, and I know you are also a very highly qualified surgeon performing robotic surgeries too. Is there a special type of robotic surgery for prostate cancer? What is the difference of prostate robotic surgery from other kinds of surgeries?
Yeah. Also in prostate cancer, like benign disease, robotic disease is a minimal invasive surgery, like laparoscopic surgery and robotic surgery, but we can also perform an open surgery. But open surgery has many side effects. If you think about oncologic results, open, robotic, and laparoscopic are same. But side effects are very different, very different. So the advantage of robotic surgery is about side effects.
What are those?
There are many side effects for prostate cancer surgery. First of all, the incision. If you have an open surgery, about
From the
20
abdomen, from this region.
15 to 20 centimeters of incision.
Oh.
We make, 15 to 20. But with robotic surgery, only 5 holes. 5 holes from here.
Oh.
You are docking the robot there and using the robot like a computer. So you are making an endoscopic surgery with robot. And also with robotic surgery, hospitalization time, bleeding is less, catheterization time is less, pain is less after surgery,
Very
especially.
important.
Going to social activities is quicker. With robotic surgery. And the most important thing is urinary leakage and erectile function. With robotic surgery, urinary leakage recovers about 90 to 95% after 1 year, but with open surgery, it's just 60 to 70%. So, what is the most important thing for men? Erection.
Yes.
Yeah, erection rates are better with robotic surgery. Of course, surgery will affect the erection of men, of course, because you are removing all the prostate from here, sometimes the lymph nodes.
Yes.
You will probably give a damage
To
for
the
the
nerves
nerves.
too.
It is important to know that the anatomy of the prostate, the nerves are just like everywhere. Everywhere. this side, this side, this side, this side.
If this is the prostate,
So if you
everyone's
want to remove it
composition.
from here, you will probably give a damage for the nerves.
Yeah.
But what does robotic surgery give? The vision. You are seeing with three-dimensional vision, especially gets increase the vision about 10 to 15 times. Normal, you see like
Yeah.
this, 15 times.
Yeah.
So you are seeing the anatomic differentiations very well. Then you can preserve the nerves better and preserve the blood vessels better. And this means that less blood loss and less side effects,
Less side
especially erection and urinary leakage.
And urinary leakage, and all are very, very important indeed. Does this robotic surgery also give advantage of using more than two hands? Because you have two hands.
Yeah. You are using 5 holes. One is for camera. Then 3 of the holes are for robotic instruments.
Instruments.
So you are using not 2 hands, 3 hands with
Indeed,
robot.
3 hands. Yeah.
Yeah. But one hand is fixed like this. You are holding the tissue, it's
Okay,
fixed,
okay.
and 2 hands is active.
That's also important.
So this means that you are using 3 hands.
This is
But
also
with
important.
laparoscopic surgery or open surgery, you can only use 2 hands.
Just 2 hands.
If you have an assistant then in the operation,
You
then
have-
you may have some more hands.
Some more
Yeah.
hands, and that also needs more people, and sometimes the conversation between two may be very important to have a significant.
But there is
Result.
one advantage for robot. It's a very expensive machine. It's one machine is about the new ones. I say the new ones about $3 million. So in many countries you cannot find robots.
Cannot find robots.
In Turkey, I think there is 34 robots. Even in many European countries, they do not have this number.
This number.
Yeah.
Yeah.
So it's a very expensive machine. Also, the surgery is more expensive than laparoscopic or open surgery.
Okay. Of course, there's a hiring problem with the machine, but I think there are some disposable materials you also use in the surgeries too. This also adds some price to the surgery,
yeah.
but it gives significant comfort for people who can give or who can afford this one. Dr. Serkan, this has been a very delightful conversation for me. Even if I am a doctor, I don't know what you are doing in this detail, and I have learned lots of things from you. I think our audience have also heard very important things from you too. Are there any more things you want to add? What are your last words for our audience for today?
My last words are: take care of yourself. After 50, you must go to a urologist, even if you don't have any problem. This is very important. Don't get afraid from physical examination. This is very important because our life is very important.
Our life is very important. Our quality of life increases. And first of all, we may prevent death, because when you diagnose cancer late, it may have severe consequences like death. Okay. We again thank Dr. Serkan Altanova, Professor of Uro-Oncology, for this delightful conversation with us, and have a good day, Africa.